What's up, guys? I'm Trevor Rosenberg, and this presentation will be on the reversal of the individual mandate from the Affordable Care Act. So, to start off, we're going to talk about the Affordable Care Act and basically summarizing it and the purpose of it. And so, the Affordable Care Act was signed by President Obama in 2010, and its purpose was to make healthcare more affordable and more accessible to everyone. It requires most U.S. citizens to have health insurance, and it gives tax credits to those with income between 100 and 400% of the federal poverty level. The Affordable Care Act also prohibits the discrimination of pre existing conditions by insurance companies, which benefits women's health the most for those with pregnancy, prior C section, and history of domestic violence. The most controversial piece of the Affordable Care Act is the individual mandate. The individual mandate requires U.S. citizens without coverage to pay a tax of $695 a year, or 2.5% of household income. However, by doing this, it makes health insurance more affordable for everyone by putting more people in the insurance pool. Under Donald Trump's presidency, one of his main goals was to repeal the Affordable Care Act. However, in 2017, there was no other solution made, so nothing was done to repeal it. However, in the recent Tax Cuts and Jobs Act, the individual mandate portion of the Affordable Care Act was repealed, allowing no tax penalty for those that do not want to pay health insurance. However, even though the tax penalty was eliminated, there is still a penalty. The individual mandate was repealed on the federal level, but states such as California, Maryland, and the District of Columbia are soon starting to experiment their own state mandates. These states may look to base their model from the state of Massachusetts. The individual mandate was based on the mandate model from Massachusetts. One benefit coming from the repeal of the individual mandate is the federal budget deficit decreasing. According to the Congressional Budget Office, the federal budget deficit would be reduced by about $338 billion between 2018 and 2027. However, critics will say that the budget deficit doesn't mean anything because the number of uninsured people is increasing under the repeal. One of Trump's options from the repeal of the individual mandate is allowing loosely regulated insurance plans. Known as short term limited duration plans, these plans are an affordable option for those who are not eligible for the ACA's premium tax cuts. These plans do not meet the ACA's requirements for coverage, but now under the repeal, the penalty for not having coverage is $0, so these plans will become more popular in the future. These plans are also being put into competitions with other ACA plans, which causes premiums for ACA plans to go up. One of the consequences from the repeal is the increased price of premiums. According to researchers, premiums on silver plans can either decrease by 1% or go up as much as 6.5% as a result of the repeal. Premiums on bronze plans can increase anywhere from 3 to 13%. Due to the increasing premiums, many people will lose health insurance or turn to federal programs such as Medicare or Medicaid. The worst part about the repeal is the increasing number of uninsured individuals. The number of insured Americans will drop by 3% or 8 million people. The individual insurance market will reduce its enrollment by 20% or 3 million people. As well, the number of young adults in the individual insurance market will decrease by 27%, which will result in more older, less healthy enrollees in the insurance pool. This will cost the insurance companies more money, which will then increase the premiums. Working in a healthcare organization as a result of the repeal will be very difficult. First off, Uninsured people do not receive preventative care, such as routine checkups or any sort of tests. When they get sick, they cannot see a doctor, so they go to the emergency room. Emergency rooms will treat them whether they're insured or not, which will lead to overcrowding and longer waiting times. Another problem is the uninsured cannot pay for their treatment at the emergency room, so the hospital has to eat up the costs. The hospital then has to increase their price on other services in order to still make a profit. As you can see, the repeal of the mandate can cause some serious problems for the healthcare industry. If we do not act soon, healthcare in the United States can be so expensive that we will not be able to go anywhere. Thank you for listening to my presentation.